our goal ultimately is to repair a valve and not replace a valve. The reason is because when you get to keep your own tissue, it's a much better long-term solution than replacing the valve. You don't have to take additional medications, and the longevity of the repair tends to last a long time. Data has shown that they can last in excess of 20 years if it's done properly. But at the end of the day, we're not able to repair all valves. Sometimes we have to replace those valves. And there's a couple of options in terms of replacing those valves. One is a mechanical valve, which will last you your whole life as long as you take a medication. And the other one is a tissue valve, which although has limited durability, you don't have to take medications. And depending on how old you are and what your disease process is, that'll determine how we treat the mitral valve. But ultimately, our goal at the end of the day is to make sure that we give you the longest lasting solution without any significant compromise to your lifestyle.